Hi, it's Dr. Shumaker. I just want to take a minute to go over your post-operative instruction from your procedure today. You should have a sheet that looks like this, front and back, with the instructions on it. I'm going to quickly hit the high points, but you're going to want to read it for greater detail on your own. After your procedure, I recommend that you apply ice packs to your face over top the surgical areas for 10 minutes on and 10 minutes off, especially during the first 12 to 24 hours after the procedure, and continuing up to 1 to 2 days can also be helpful as well. When applying ice packs, don't push too hard as not to push your cheeks and lips against the surgical area, putting pressure on it. Be aware that swelling and black and blueness is normal with most procedures and generally resolves by 3 to 5 days post-op. If you're a smoker, tobacco, or cannabis user, please no smoking for the first 3 to 4 days after surgery. And of course, it's a great time to cut back or quit completely. For obvious reasons, smoking or dip use of any kind can cause major complications in the mouth. Please do not pull out your lip or cheek and look at the surgical sites. Every time you do that, it can pull everything away from the gums and cause healing complications. The best thing to do is just leave it alone undisturbed. If you do see some parts of the gums in your smile, don't be alarmed if it looks funny, shows different colors, or appears a little lumpy. That is normal for as long as 1 month after the procedure. You may experience some degree of tooth sensitivity, especially to cold, after the procedure that can last up to 2 months. So be aware of that. You may have some bleeding or slight oozing of blood from the surgical site for several hours after the procedure, which is somewhat normal. If the bleeding is excessive, you can apply gentle pressure to the bleeding area with some cold, damp gauze or a cold, damp black tea bag for several minutes. When applying pressure for bleeding, it works best if you don't let go for 15 to 30 minutes to give it time for clotting to occur. If it doesn't stop or you have excessive bleeding, please contact the office. As far as medications, if you were given antibiotics, please take as directed on the bottle. The assistants will also have given you a pain control instruction sheet with recommendations as far as what types of medications will work for pain control. Please review and follow this. If you were given narcotic pain medications such as hydrocodone or oxycodone, be aware that while you're on a pain medication like that, you don't want to be operating machinery, making important decisions, or signing legal documents, as these medications can impair your judgment. If you have any kind of reaction to any medication given, please contact the office. And of course, if it's a very severe reaction such as difficulty breathing, call 911 or go directly to the ER. You may have had a packing material placed over the surgery area. This material will generally fall off in 2 to 4 days. If it does stay on longer, that's fine. We'll remove it at your post-op visit. If it does come off earlier than 2 days, please contact the office. You may have also had a plastic healing stent delivered, which is similar to a retainer. If you did, you'll be given a separate instruction sheet on how to use that appliance during healing. Brushing and home care after the procedure depends on what specific procedure you had done, but for the majority of surgeries, I recommend no brushing, wire pick use, or flossing on the gums at the surgical area for a minimum of 2 weeks. You'll be given an antibacterial mouth rinse to use while not brushing. The one exception is gum graft surgery. If you had gum graft surgery, do not brush the gum graft area for 4 to 6 weeks. For all surgeries, we'll give you further instructions on home care at your post-op visits and let you know when it's okay to go back to normal. Please do not go back to fully normal home care, such as using a power toothbrush or a water pick, until we've given you the okay to do so, as starting early can damage the surgical area. During healing, it's okay to brush and floss the rest of your teeth normally as long as you avoid the surgical areas. You were either given closest mouthwash or a Stella Life rinse and or gel to use to aid healing and reduce infection risk. Mouth rinses should be used gently 2 to 3 times per day for 30 seconds. If you are given Stella Life gel, you will want to gently apply the gel to the surgical area with a clean finger 4 times per day. If you are given other Stella Life products, please review the instructions on the box. In addition, you can also rinse with warm salt water between these other rinses. When rinsing, do not rinse too vigorously as it can disturb healing. If you did have a dressing or healing stent, it is fine to use rinses with that in place. With eating and drinking after your procedure, it's important to maintain a good food and fluid intake after the procedure for healing. It just needs to be soft thing. In general, when possible, try to chew on teeth not involved in the surgery, such as the opposite side. Of course, if we did the surgery on both sides, then you have to be extra careful. As far as what foods to choose, I generally tell people if you can squish it between your fingers, you can eat it. You don't need to be on a liquid diet, but you want to stick to soft things. You want to avoid things like potato chips, cockroach shells, almonds, and in general, really crunchy stuff for up to 4 weeks. Please do not use a straw to drink or consume any carbonated beverages for 3 to 4 days after the procedure, because that can cause suction at the area and irritation of the surgical areas. If you had dental implants placed and we put on healing caps, please don't eat on the caps or use the healing caps as a tooth. We don't really want any biting force on dental implants for the first 2 months. In dental implant cases where we placed a bridge or teeth on the implants immediately on the same day or shortly after, you also want to stay on very soft foods for up to 2 months to avoid damage or failure of the dental implants while they're healing. As I generally want you to avoid exercising for about 4 days. The main concern is your blood pressure and heart rate can go up when you exercise and it can cause bleeding. So no heavy cardio workouts are recommended for 4 to 7 days. And once you do resume exercise, start with something easy like a walk. Don't go out and run a marathon on day 5. Just kind of ease your way back into it. If you had a surgery that involved your sinuses, the assistant will give you a separate sinus precaution sheet. Please review and follow along with those specific instructions. I want you to call the office or contact me if any of the following things occur: prolonged or excessive bleeding, severe pain not relieved by medications, fever, swelling that gets better and then comes back again, any reaction to medications, or any other significant risk concerns. If you have a post-operative emergency during regular business hours, please contact the office. If it is after hours, on the bottom of the sheet are the doctor's cell phone numbers. You can text us or call us with major concern. If you have a true or serious emergency, don't hesitate to contact the ER, urgent care, or call 911. Thanks for listening, and we'll see you at your post-op visit.